You have to differentiate the patient that has hypothyroidism, which is that the thyroid gland is not producing enough hormone, or you have the patient with hyperthyroidism that is completely the opposite, that the thyroid is overproducing the thyroid hormone. So two different sides of the spectrum. So you have the hypothyroid patient who complains of weight gain, tiredness, lethargy, dry skin, hair loss, irregular menstrual cycle. And then you have the hyperthyroid patient that is totally the opposite, a very anxious person that can't sleep well, that has palpitations all the time, which means increasing the heart rate. Again, feel tired, but it's a more overwhelming tiredness. It's like, okay, I'm going upstairs and my heart rate goes up pretty quick. But that lack of sleep is very disturbing for those patients. Now, in terms of what causes it, the majority of the cases, either hypo or hyperthyroidism, are due to an autoimmune disease. So for hypothyroidism, we have Hashimoto thyroiditis, which is when the body creates antibodies against thyroid peroxidase enzyme. And then you have in the hyperthyroidism side, Graves' disease, which is when the body produces the thyroid-stimulating immunoglobulin that it will accelerate the thyroid, the production of the thyroid hormone on your body. And there's obviously other reasons for people to be hypo or hyperthyroid, but those are the most common ones.